Billionaire philanthropist Bill Gates and Nigerian business magnate Aliko Dangote have emphasized the importance of innovation and partnership in driving health. In collaboration with Ugweidi Joma Wokoma donated sanitary pads to over 500 students in Cooperative College in Ohaji, Ebema local government area of Imo State. Their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure. Good day, viewers. Welcome back to DDM Health News Updates on our program, Your Health, Your Wealth. I remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, so you get the latest on health. Okay. Maternal health experts have asked pregnant women to avoid sleeping on their back after the first trimester. Please take note. The gynaecologists warned that such a sleeping position could cause the veins supplying blood to the vital organs of the body to collapse, resulting to adverse effects on the woman and her baby. According to the experts, sleeping on the back is a very uncomfortable position which might lead to the shortage of blood to the brain, heart, and the baby itself, especially when the woman is in that position for a very long time. The physicians pointed out that the ideal sleeping position of pregnant women during the second and third trimesters is the left position, as it helps avoid the weight of the womb and the baby pressing to the blood vessels. They advise pregnant women to sleep on the left side, please. Studies have linked back and right side sleeping with a higher risk of stillbirth, reduced fetal growth, low birth weight, and preeclampsia, a life-threatening high blood pressure disorder that affects the mother. Speaking in an exclusive interview with DDM Healthwise, an associate professor and consultant obstetrician and gynecologist at the University of Nigeria Teaching Hospital, Ituku-Ozala, Enugu State, Dr. Uche Agu, said it was important for pregnant women to avoid sleeping face back. This, Agu said, was because the woman might be having a fainting attack owing to the collapse of major veins supplying blood to the heart and brain. The gynecologist said, when a woman is pregnant, sleeping position is important, considering the considering the placement of the blood vessels on the spines at the back. The relationship of the blood vessel to the spines is quite close to the back. Yes. Now, the vein that returns blood to the heart and brain is just already lined on that spine, and the artery is also beside it. The maternal health specialist noted that as pregnancy progresses, getting enough sleep becomes vitally important for both the mother and her growing baby. When a woman is pregnant, the womb is enlarged, and because of the size of the womb, if the woman lies on her back, that womb presses on those blood vessels, which is wrong. And the one is compressed more is the vein, and the vein can collapse at any time. Yes, the vein is collapsible. That is the one that returns blood to the brain and the heart. That one can collapse easily. Please. Continuing, Agu said poor blood supply to the heart and brain makes the woman dizzy, sweaty, and feels like vomiting. Yes, if it is the artery can still pump, but if the womb rests on the major vein that pumps blood to the heart and brain, it collapses, and if it collapses, there will be reduced blood to the brain and to the heart. And the woman will be having a fainting attack. That's the worst. She will be feeling dizzy and sweaty. The woman might vomit and may even die if she stays in that position for a long time. So, if a pregnant woman lies on her back for a long time, like for some minutes, she will start sweating, feeling dizzy because the blood supply to the brain has been reduced. Well, this is because the womb is pressing to that major vein, collapsing it and forcing the blood to return to the heart and the brain. When the blood returns to the heart pumps it to the lungs, and the lungs now pump it to the brain. Yeah, that is how it goes. That's the process. The blood returning to is reduced drastically, and that is what makes the woman feel like that. And if the position persists, it can really cause death. Sure, take note. The maternal health specialist, however, said such a sleep position might not persist because the woman would turn immediately. He said that the sleeping position of the pregnant woman doesn't affect the child, but only the woman. But Ago also said the collapsing of the vein is not a permanent thing. Okay, let's hear him out. According to him, the ideal sleeping position for a pregnant woman is the left side. I keep on emphasizing the left side. The gynecologist noted, we prefer the woman to sleep on the left side. We call it the left lateral position. This is to take the pressure off the veins. If the woman sleeps on her back, the womb, that womb will press on the blood vessels. But if she sleeps on the left side, the pressure is off the vessels. That is how it goes. She can sleep on the right side too, but that right side may not be very ideal. But she can sleep on either side, sure. What we don't want is sleeping facing up. It is a very uncomfortable position. Ago advised pregnant women in their second and third trimesters to avoid sleeping face up. I keep on repeating. Collaborating with Ago's statements is another consultant obstetrician and gynecologist, Dr. Philip Epe, who said sleeping position in pregnancy might be ignored in the first trimester, but during the second and the third trimester, when the womb and the baby increase in size, no. Epe, a former Secretary General of the Nigerian Medical Association, said the average weight of the baby is 2.5 kg to about 4 kg. So in the first trimester, the pregnancy is not that heavy. But the second and third, the pregnancy becomes heavy. Now, the veins can supply blood. The veins that supply blood to the vital organs like the brain, heart, kidney, lungs, liver, and the baby itself are usually trying. If the woman lies on her back, the uterus itself with the baby lying inside is now like a weight that will compress the blood vessels and prevents blood supply to those vital organs, even to the baby, which can lead to collapse of those veins. So to prevent that, they should lie by the side. Please. According to an online portal, Medical News Today, many women find themselves wondering how best to sleep when pregnant. Some may even just lie at the back. No. Sleep issues are common during pregnancy. Yeah, especially in the third trimester, when finding a comfortable sleeping position can be challenging because the stomach is now very big. So pregnant women may also worry that certain body position might affect their health or that of the fetus. As a woman reaches the second and third trimester, it is ideal to sleep on the left side. I keep on lamenting the left side. A National Sleep Foundation survey trusted source found that 78% of women have more trouble sleeping when pregnant, with 15% experiencing restless leg syndrome during the first trimester. Sure, that is true. Some might think like their leg might increase while sleeping on one particular position or the other, but no. We keep on lamenting. Sleep on the left side. You can also sleep on the other side, but the left side matters. So please take notes. Sleep on the left side as a pregnant woman. Next, a writer suffering from Parkinson's disease has become the first to die through medically assisted suicide under a fast-track regional law in Italy, campaigners said Wednesday. Daniel Peroni died at home on May 17, 3 months after the new legislation was passed by regional authorities in Tuscany. That's the Pro-Eutanasia Luca Consioni Association said. The Italian Constitutional Court ruled in September 2019 that assisted suicide was allowed for patients in certain circumstances. But the national parliament has yet to adopt any legislation, which means that obtaining permission to die is difficult and can take years. In February, Tuscany, ruled by the central lefts, became the first of Italy's 20th region to set out its own rules, streamlining and speeding up the request process. Prime Minister Giorgia Meloni's right-wing coalition is broadly against euthanasia and is challenging the Tuscan law in courts. You can imagine someone taking suicide and being approved. But any decision on that will come too late to affect Peronia's choice. Born in 1961, the writer has been suffering from Parkinson's disease since 2008 and now was forced to use a feeding tube for 21 hours a day. You can imagine. Oh, so sad. The local Cosconi Association said in a statement, the literal drug was prepared at his home, which Daniel self-administered in the presence of doctors and his family. As the statement continued, it has called on other regions in the Catholic majority country to follow Tuscany's lead. Too many people continue to suffer or emigrate to death with dignity, said the association header. So, we invite all regions to act to guarantee freedom and respect for people's wishes. But looking at it, how would I allow someone to die because of that's what the person wished for? It's not gonna be easy at all. Helping someone take their own life is technically illegal in Italy, punishable with between 5 and 12 years behind the bars. You can imagine, and this time around, someone broke such a law. But the Constitutional Court made an exception for those facing an incurable illness causing intolerable physical or psychological suffering, where they are kept alive by life support treatment but remain capable of making free and informed decisions. No wonder the person took his life. So, since the 2019 court ruling, 8 people have committedly medically assisted suicide in Italy, the association told AFP. Oh my goodness. Medically as in the, oh my, so sad. The first was a tetraplegic man, that is Federico Carboni, 44, from the Marche region in June 2022. You can imagine assisting someone taking his or her own life. Well, you can imagine sometimes there's some medical condition or challenge you might face. You might be like, I just want to give up. Maybe feeding through the feeding tube, urinating through the catheter, and so many other conditions that you can't even do things on yourself. So, well, I won't blame them, sure. But life matters, no matter what condition you find yourself. You don't have to take your own life. It's very precious. Sure, it is. Some wish for that life. They never wish to die. So please, if you're in such a great condition, sorry. If you are in such a challenging condition, don't take your life. It matters. Your health matters a lot. Well, with this, we come to the conclusion of our news today on our program, Your Health, Your Wealth. Be sure to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, so you get the latest on health and know how to take good care of your health. Until I come your way, I am Nayer Michaeline Izini. Do have a wonderful day. Thanks for watching. Bye for now.